And now, it's BoomerLife, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is BoomerLife on CIL 650.
Hey, and welcome to the show on CL 650. I'm Zach Spencer, and we're speaking with the SnoreDentist, Dr. Charnel Muir, and it's such a catchy phrase that you have, which really basically sums it all up. It's right here. It's sleep better and live better, and that really basically describes life. If you're getting a good night's sleep, you're going to have a better day.
Better life, for sure. Yeah.
So why don't you talk about our special guest that we have on the phone, Dr. John Remmers. You obviously know Dr. Remmers. You can give a little background and before we introduce him.
Okay, just absolute pleasure of mine. You know, Dr. Remmers is really been instrumental in a number of areas of sleep, whether it be sleep monitors that patients have used at home, whether it be the auto CPAP machine, and now into the field really of how to best treat, predict, and assess patients for oral appliance therapy. So he's been a huge advocate for oral appliance therapy. He's definitely world-recognized physiologist. He's been a pioneer and innovator in the sleep medicine world. A renowned expert in snoring and obstructive sleep apnea. He's published over 100 peer-review articles in the area of respiratory physiology. He's just a wealth of information.
Okay, Dr. Remmers, how do you feel about that introduction? That's pretty good.
Pretty scary. I'll try my best, folks.
Well, it's just a privilege to have you with us, Dr. Remmers.
Well, thank you. It's a pleasure to be here. This is a very important topic, and I want to compliment Zach on bringing it on and Dr. Muir for pushing it ahead.
All right. Now, as a layperson, I have heard so much more recently about sleep apnea and sleep issues, where when I was younger, I never really heard about this. Is it becoming more mainstream that people are aware of obstructed sleep?
Yes, that's really the case. I had a similar experience 10 years ago when someone walked in my office and I told them they had sleep apnea. They give me this quizzical look, this wide-eyed look. What's going on? What's that mean? Nowadays, it's not that at all. I say sleep apnea, they nod. They suspected they already had it and just want to talk about what they could do about it. So it's a great improvement that the actual client themselves understand what's going on here and a little bit already about the treatment before they encounter that.
So how did you get to where you are today in this field?
Hard work. So it was 40 years ago, believe it or not, in a lonely night in a University of Texas hospital when I'd essentially discovered sleep apnea and went on to lay out how it actually does its dirty deeds and disrupts your sleep and drops your oxygen during sleep. And then there's an inventor side of me, and so I invented some devices related to this positive pressure that we call continuous positive airway pressure, or the dreaded mask. And then more recently, I've felt that the important advances to be made lay in the area of dentistry, believe it or not, and the treatment of sleep apnea by a simple dental appliance.
Mm-hmm. And when you started this, did you think that you would end up with the oral appliances? Where did you think it was going to go?
Zach, when I started, there were only one kind of patient, and they were these massively obese people who would very quickly die. It wasn't much fun, and they were all dying, and I thought that was the nature of the disease, and that's all we were going to deal with for the rest of my life. Well, it turns out that lots of people, lots of skinny people even have sleep apnea, and I had no idea of how common it was, how pervasive it is, and literally also that it not only compromises your quality of life, but that it also can cause heart attacks and strokes. So, this was totally a trip beyond belief, Zach.
Now, how did you get from being in the southern United States to ending up in Calgary?
A good job. I was always working away in an academic situation. That means I was teaching medical students and doing research. To really do a good job in research, you need to devote a lot of time to it. And the province of Alberta had established the Heritage Foundation for Medical Research, and they brought me on as a scientist and gave me lots of time to carry out the research, and I had a great 30-year career here in Canada.
So what is it that you think that the average listener of the show here today can take away? What symptoms should they be looking for? How can they look themselves in the mirror and they probably suspect something's not right? What would you say to them?
Well, I would. You might expect that I would say, maybe you'll be sleepy. Mm-hmm. Well, Zach, it turns out half of people with sleep apnea are not sleepy. So let's talk about what someone should think about or worry about. And the first would be snoring. So a patient who snores might have sleep apnea. Then in addition, if they have someone has told them that they stop breathing during sleep, are they awakened gasping and choking during sleep? Well, that's another sign. And finally, there's the possibility that they may be overweight or have a large neck, and that would be another sign. There's a few more that are kind of not really understood too well, but it is having high blood pressure. So if your arterial blood pressure is high, that would be a sign possibly of sleep apnea. And then to move over into Dr. Muir's field, if you grind your teeth at night, that's another signal, symptom, or sign that we have. So if you have been told by your dentist that you grind your teeth at night or clench them, then it would be another way of thinking about sleep apnea. Those are the general areas that give you a tip-off that you may have something.
So can you explain the correlation between the snoring, the sleeping, and other health effects? How does it affect the rest of your life?
Well, the health effects, it's going to compromise your quality of life. No doubt you can be sleepy, or you can be depressed, or you can have a loss of memory, and so on. But we also nowadays worry about what serious illnesses run with sleep apnea, and oh my goodness, it's just a long laundry list. You would be amazed, but it can be atrial fib. You hear about that a lot on TV now. So atrial fib, strokes, high blood pressure, diabetes, just to name a few. These run, they're fellow travelers, I would call them, with sleep apnea. And if we can treat the sleep apnea effectively, then we hope we can avoid the complications of these disorders.
When we come back in just a few minutes, we're going to talk a little bit about what Dr. Muir does, and also a development that you have come up with called the Matrix Plus. So when did you switch from the CPAP line and into the oral appliances? How long ago was that? 15
years. That's how long it takes to develop a new product or a new idea. And so, yes, I became aware that while everybody pushes CPAP onto the patient who has sleep apnea, that it wasn't really enjoyed by many patients. They didn't like it, and in addition, I felt that there was a problem because they weren't going to be using it long term. So you can understand that the need for alternative therapy was really high on my priority list about 10, 15 years ago, and we came up with a new approach that would allow us to understand for any given patient a bit more about how the oral appliance would work for them.
All right, that's the voice of Dr. John Remmers. He's our guest along with Dr. Charnel Muir, the SnoreDentist, located in North Vancouver, and we're talking about oral appliances. And Dr. Muir, that's your field.
That's what I do. So my passion in life is to get patients in, get them looked at, get them properly diagnosed, and then send them down a path that is an appropriate therapy, and oral appliance therapy can be appropriate for a majority of those patients.
And you're also seeing the same thing about people who have tried CPAP, is they try it for a while and then they take it off and they can't tolerate it, right?
Yeah, so there'll be a number of patients that are sent for a CPAP trial based on their physician's knowledge that that's the treatment that's readily available for them. And then, they make it through the trial or not, and some people can't even tolerate it for the first few weeks. Some people, by the end of the first year, they're still not compliant as prescribed with the therapy. It can be difficult for some patients to put up with that. And if that patient is an appropriate patient for an oral appliance therapy, unfortunately, sometimes they're just not told about it.
Mm-hmm. Well, when we come back, we're going to find out about a new product that is just about to be launched here in Canada, and Dr. Muir will be the first one in Canada to have this in her practice, and we're going to find out more about it next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.